This video will cover acute promyelocytic leukemia. The anchor for this video begins with this character's amulet. As we already know, amulets are our symbol for AML because the word amulet can easily be shortened to AML. Next, if you notice what this amulet is made of, it's made of pearls. Pearls will be our symbol for promyelocytes because they kind of sound alike. As an extra, the shape of this amulet also represents something. Many times the nuclei in these abnormal promyelocytes will have a butterfly shape. Some people call them sliding discs, others say kidney-shaped, and some will even say bilobed. I think that butterfly shaped is the best and also easiest to remember. This AML is defined by a translocation between chromosomes 15 and 17. As in prior videos, the number 15 is represented by a quinceañera dress, since quince translates in English to the number 15. Her dress is also this nice chrome color, which will help us remember chromosomes, since chrome is our symbol for chromosome. Our representation for chromosome 17 will be her snack of choice here, which are these saltine crackers. The word saltine sounds like the number 17, right? The genes involved in this translocation are PML and RARA. I'm not going to create a prompt for the PML gene since that one's easy to remember because it essentially is just the word promyelocyte shortened to PML. To remember RARA, however, take a look at this character here who's super into his game and even yelling out RAR, which in my opinion sounds similar to RARA. These patients tend to present in DIC, and we'll easily remember this by the fact that there's some abnormal red rain in this image. APML is highly sensitive to all trans-retinoic acid or ATRA. I prefer just to remember that ATRA is a metabolite of vitamin A. And to easily remember that this APML is treated with vitamin A, look at these stacks of hay in the back here. Doesn't hay sound like the letter A? The ages primarily affected are from the late teen years to about the age of 60. Since our character is in her teen years, we'll just remember that it's about the age where it starts, and then we can just remember that it goes all the way up to late adulthood. We all know what promyelocytes look like, and we know what the atypical promyelocytes in APML look like. It's important to remember, however, that there is a hypogranular variant of APML that may resemble acute monocytic leukemia because of its lack of granules. Additionally, the hypogranular variant often presents with a high blast count, while the typical hypergranular APML presents with very few leukemic cells in the peripheral blood. We're going to have a prompt to remember this. You see this container of sprinkles exploding? Couldn't these sprinkles be compared to essentially small granules or hypogranules? And since the container is exploding, we'll remember that the hypogranular variant presents with high blast counts. Let's move on to the immunophenotype of the neoplastic cells. CD15 is characteristically expressed weakly. This is in contrast to normal promyelocytes, which are CD15 bright. Well, let's go back to our main character wearing the quinceañera. Oh, okay, that's why she looks so tired, and I guess you could even say weak. HLA-DR is also characteristically negative in the neoplastic cells. In prior videos, our symbol for HLA-DR was a doctor that worked for a hospital system named HLA. But as you can see, our doctor's out on vacation today. Good for him. Him being out on vacation will clue us into negative HLA-DR. Negative CD34 is the next typical finding. In other videos, we've used a dirty door to represent positive CD34 because the number 34 sounds like dirty door. But if you look at the door in this image, it's exceptionally clean, which obviously is the opposite of dirty and will remind us of negative CD34. One extra note, which I won't represent but I think is worth mentioning, is that the hypogranular variant of APML may express HLA-DR and CD34. There are two variant translocations which of course are less common than the 15-17 PML RARA. Those are 11-17 and 5-17. These are characteristically less responsive to ATRA than normal APML. Because they are less responsive to ATRA, I put their symbols on top of the haystack here. The chrome beehive will remind us of chromosome 5 since beehive is our symbol for the number 5 and chrome is our symbol for chromosome. Okay, and I'm going to introduce an edited prompt now for the number 11. I really hated the prompt that we were using prior to this video for the number 11, so I came up with a new one, which we're going to use from now on. The prompt is this lever, because the word lever is similar to 11. The last point to remember about APML is that differentiation syndrome, also called retinoic acid syndrome, is a potentially life-threatening complication of treatment with ATRA. These patients may present with fever, weight gain, anasarca, effusions, hypotension, and renal failure. Our representation for differentiation syndrome, which is often referred to as DS, will be the video game that this kid is playing, a Nintendo DS. Steroids are commonly used as prophylaxis and as treatment for differentiation syndrome. Since there is an asteroid graphic on his t-shirt, that's how we're going to remember steroids, since asteroid and steroid sound so alike.